Lowcountry View of Hilton Head. My name is Earl Yates. I'm your host. And today I will have one of the island favorites, Brad Fraum from Fraum Chiropractic Life Center. He's been a local staple for quite some time. I mean, if you think of chiropractic on Hilton Head, it's pretty much the first name that you come to. And without further ado, Brad, how are we doing?
Hey, Earl. Thanks for having me over today here.
Hey, it's pleasant. Very, very good time.
Yes.
Now, just to start, how long have you been practicing here on the island?
Been on the island 20 years.
20 years. Yeah. That's quite some time to be operating on Hilton Head. I mean, times have changed, and right. We've gone through so many different island changes, from locals to tourism, and now it's a boom that you have just everyone together, just gathered for a friendly holidays as we're going through right now. And you've worked through this whole situation for 20 years. How has that been for you?
Well, it's been really good. We've enjoyed it, and we keep moving forward. We kind of pride ourselves where the locals go and the tourists are welcome.
Well, besides the locals and the tourists that come through, I mean, I can remember some time ago having your name in the paper, of having Lennox Lewis show up in your doorstep and ask for chiropractic help. How did that come about?
Well, yeah, that was real interesting too. That was he was a great fighter and a great person, and he's just a strong advocate of chiropractic. And so he trained here on the island for 8 weeks, and we gave him chiropractic care, and his staff also. And then he took my wife Sharon and I to Las Vegas to his fight out there, and he got chiropractic care out there too. So it was real interesting, and it was a great time.
So I would imagine at that time you made a very big name for yourself at that. Of course, you were doing well and pretty good at what you do, but once the name gets out there that you're treating famous people, of course everyone floods in. Besides Lennox Lewis, we have just a ton of celebrities and big names in the world travel to Hilton Head. Besides Lennox Lewis, who else have you had on?
Well, let's see. Actually, our first patient when we were visiting Hilton Head was Robert Plant from Led Zeppelin. He was a very interesting person. And we deal a lot with the staff and the performers for the Self Family Arts Center. So when actors come to town, we try to make them welcome and give them chiropractic care. Air Supply, Eddie Money, those groups as they come through. Little River Band, just different people that all enjoyed it. We want to make them feel welcome on Hilton Head.
Well, now, obviously, if you have a situation where, the stars and celebrities are interested in having chiropractic help, what is the basis of your job? I mean, why? I know it's a sense of well-being that people go to chiropractors, but what is, if you were to instruct someone to come into your office, what is it they should look to achieve once they're there?
Well, you're right. Wellness is what we're trying to advocate. The wellness doctor, trying to get to the cause of the problems they're having and preventing other problems from occurring too, be it neuromuscular problems and organic problems too, because the nervous system innervates all organs and muscles in the body, and any interference to that system will allow our body to have what we call dis-ease, which is the word disease comes from, which is the body not at ease. Symptoms are the last stage of healthcare problems.
So if it's a matter of well-being and disease comes after not being well, I mean, what are there are some symptoms that we as everyday folks, when we're going through and not feeling the best, what are some of the symptoms that should alert us to knowing that we should visit a chiropractor?
Well, it could be fatigue, it could be muscular aches and pains, just not feeling as alert, anxiety, stress, things like that. But a lot of times there are no symptoms. When the vertebrae go out of place, 80% of the nerves sense no pain. So it's kind of like the guy that walks out one day and drops dead of a heart attack. And they said, well, you know, he's never done that before. And we say, well, you know, he's not going to do it again either.
For sure.
So we want people to have their spines checked, whether there are symptoms there or not, because symptoms, again, are most of the time the last stage of a healthcare problem.
Well, I mean, when you think of chiropractic, a lot of it is kind of geared, you think, almost like massage therapy, of course. But, of course, it's a medical science. So, therefore, you're doing a whole lot more than just rubbing and giving massages. How did this come about? How did you decide that this was going to be the field that you were going to work in?
Well, chiropractic, for some reason, since we work with the spine, has been relegated in a lot of people's minds to we're the back doctor. But in actual fact, we're affecting the nervous system. And I had fantastic changes with my health. I was pre-med originally from City University of New York, and kind of tripped over chiropractic, had very bad allergies and borderline asthmatic, and I saw my health improve so much through chiropractic. I went from a college student that could not play sports to an avid water polo player.
Wow. So now, in chiropractic, I mean, I've of course, through you, I've had the pleasure of being on your table and getting straightened out a little bit. I mean, it's, of course, right away you feel the relief and the tension is gone. How do you go about setting up a routine with your center?
Well, you would come in, or one would come in for an initial evaluation, and we would examine their spine. If x-rays are necessary, we would do that on premises. When we would have them after their first adjustment for a follow-up visit in a day or so, see how well they're holding their adjustment, and then you get adjusted more frequently in the beginning and less frequently as you go on, because your body innately wants to start holding these adjustments as our body strives to regain health.
So basically, when you show up for your first appointment and you're treated, should one expect to feel a little more discomfort? Because, of course, if your spine is not aligned correctly and your body adjusts accordingly, once that happens, I would think that you feel a little uncomfortable at first.
Well, there's a few different ways you would feel after an adjustment. The uncomfortableness is for the minority. Those are, you might get a little Charlie horseness for 15 minutes of new muscles working to pull the spine back in place. And you're right with that, too. But we don't hear that very much, though, too. As we start off and we're adjusting the spine gentle, you'll feel well-being. People will talk about, I just feel better. It's hard to explain. Sometimes I use the analogy, it's like putting on eyeglasses for the first time. You say, gee, I didn't know I can see that well. Well, you never experienced that.
Well, basically, with your treatment, what do you recommend for most, even if there's no back problems, you're looking for preventive maintenance, what do you recommend for people as far as chiropractic help? How often should we come in?
Well, everyone's different. Depends if how old they are, how long their spine's been out of place, their inherent muscle tone to hold their adjustments. So it's, everyone's different. It could be 3 times a week to start with. It could be twice a week to start with. It might even be once a week to start with if they had past chiropractic care. And then it would decrease in frequency from there.
Well, lately you've been voted as the island's favorite chiropractor. So obviously there's a lot going on very well when people come to your center. Where is your center located?
Our center is at 1403 Main Street Village in the Harris Teeter Shopping Center at the north end.
Well, you've been there for quite some time. I mean, obviously, those who have been there really know the pleasure of having chiropractic work and knowing the pleasure of having you do it. I mean, obviously, that's why you're the island favorite of it. If there's one thing that everyone can take away from this interview, Basically, what should you let people know about chiropractic that the obvious is not there? Like,
well, I want people to start taking responsibility for their own health. And I don't want to get too political in our arena of healthcare reform, but we need to start reforming our own healthcare, take responsibility for our own health, and look and see what makes sense to us as individuals for our healthcare. Obviously, we're in the age of proactive as opposed to reactive healthcare, and chiropractic is that major paradigm shift in that healthcare arena.
Well, you know, Brad, I appreciate you
Earl,
coming on.
lot.
I mean, it's definitely an area that everyone needs to be more familiar with because, like you said, it's more about catching a problem before it actually starts. And preventative maintenance is always the best thing. It doesn't matter if you're dealing with your body or you're dealing with a car. You know, you want to take care of a problem before it actually is a problem.
That's right.
Well, this has been the first half of the show, and I've had Brad Fraum on from Fraum Chiropractic Life Center, and we'll take a break, and I'll be right back to see you.